So we will talk about temporal, infratemporal, and pterygopalatine fossa, as well as the submandibular region and salivary glands. I know this lecture is a little bit long, complicated, but it is so important to know each part of this region of the neck. Temporal, infratemporal, and pterygopalatine fossa. The temporal fossa boundaries superiorly and posteriorly. The superior midline, the superior temporal line, it is the upper part superiorly and posteriorly. So superior temporal line, the boundaries is superior and posterior one. Inferiorly, we have zygomatic arch. While anterior part, we have frontal process of zygomatic bone. Medially, there are 4 bones forming pterion, and all of us, you have to know pterion, which I'll come to talk about it a little bit, but I have explained it in the previous lectures. So pterion, 4 bones, these are frontal bone, parietal bone, squamous part of temporal bone, and greater wing of sphenoid. So boundaries of temporal fossa, superior and posteriorly, superior temporal line. Inferiorly, zygomatic arch. Anterior, frontal process of zygomatic bone. Medially, 4 bones. They are frontal, parietal, squamous part of temporal bone, and greater wing of sphenoid. What are the content of temporal fossa? Temporal muscle covered by temporal fascia. Temporal muscle arises from the floor of temporal fossa. So the whole floor of temporal fossa is the origin of temporalis muscle. And masseter muscle arises from zygomatic arch. This is the temporal fossa. Infratemporal fossa, space behind the maxilla. Space behind the maxilla. Below and medial to temporal fossa. So it is a space behind the maxilla, below and medial to the temporal fossa. What are the content of the infratemporal fossa? 1. Deep muscles of mastication, medial and lateral pterygoid, and mandibular nerve and part of maxillary nerve, as well as maxillary artery and pterygoid plexus of veins. So infratemporal fossa contains the deep muscles of mastication, medial and lateral pterygoid, mandibular nerve, and maxillary nerve, as well as maxillary artery and pterygoid plexus of veins. The last fossa is pterygopalatine fossa. It is a triangular space below and behind the apex of the orbit. So it is triangular space below and behind the apex of orbit. Content: maxillary nerve, maxillary artery, and sphenopalatine ganglion. Content of temporal infratemporal fossa: 1. Temporal fascia. 1. Temporal fascia, dense fibrous membrane covering the temporal muscle. Temporal fascia is a dense fibrous membrane covering the temporal muscle. It is attached above to the superior temporal line and below to the zygomatic arch. That is temporal fascia. 2. Muscles of mastication. They are arranged in 2 layers. The first layer formed of temporalis and masseter. Temporalis and masseter. And the second layer formed of medial and lateral pterygoid muscle. Nerves: mandibular nerve, cordia tympani, maxillary nerve, as well as otic ganglion. Facilis: maxillary artery and its branches. All muscles of mastication, temporalis, masseter, medial and lateral pterygoid, are supplied by mandibular nerve, branch of trigeminal nerve, and all protrude the mandible except temporalis, which is retracted. So all muscles of mastication protrude the mandible except temporalis, which it will retract it. The temporalis and masseter are powerful elevator muscles, and the lateral pterygoid lower it. The temporalis and masseter are powerful elevator muscles, and lateral pterygoid lower it. The medial lateral pterygoid muscle moves the mandible from side to side. This is a picture of the pterygoid fossa and temporal fossa and infratemporal fossa. So this is the temporal fossa, this is the infratemporal fossa, and this triangle is pterygopalatine fossa. This is the temporal line. The temporal line started as 1 line, and then it will divide into 2. Superior temporal line and inferior temporal line. The fascia are coming from the superior temporal line. And the whole area, this is the temporal fossa. And these are the bones which form the medial surface of the temporal fossa. Frontal bone, parietal bone, temporal bone, and sphenoidal bone. They are meet to each other in the area H-shaped. So this is the sutures, and this is the H-shaped space. This is one line, and this is the one connected. This is the area where we say pterion, which we explained it before. That is the place where we have to do power hole surgery if there is a intracranial bleeding. If there is subarachnoid bleeding, we will open this area and will close the middle meningeal artery if there is bleeding. This is the external auditory meatus, styloid process, mastoid process. This area is known as astrion. So astrion is the area where the meeting of occipital and mastoid and parietal bone. Content of the temporal fossa and infratemporal fossa: muscle of mastication, temporalis, masseter, medial lateral pterygoid, mandibular nerve and its branch, maxillary nerve for a short part of its course, maxillary artery, and pterygoid plexus of veins. These are the muscles of mastication. Just we make this comparison to be easy for you to remember it. Muscle of mastication are temporalis, masseter, medial, lateral pterygoid. Temporalis, masseter, lateral and medial pterygoid. Temporalis muscle, origin from the floor of temporal fossa, inferior temporal line, deep surface of the temporal fossa. So floor of temporal fossa, inferior line and deep surface of temporal fossa. Insertion, tip and border of medial surface of coronoid process of the mandible. Action, retract and protrude the mandible. This is the temporalis muscle. The second muscle are masseter muscle, the strong muscle, lower border of the inner surface of zygomatic arch. So origin from the lower border of the inner surface of zygomatic arch. Insertion to the lateral surface of the ramus of the mandible. Action, elevation of mandible, protrude the mandible, and anti-gravity action. This muscle, when the patient has tetanus, it will lead to contraction, spasm, tonic spasm of the muscle, and it lead to lock of the temporomandibular joint. Lateral pterygoid coming from the upper head. They are upper head and lower head. Lateral pterygoid has two heads, upper head and lower head. Upper head, infratemporal crest of the infratemporal surface of the greater wing of sphenoid. Lower head, lateral pterygoid plate of sphenoid. Inserted, the two heads are fused together. The two heads are fused together and inserted to the pterygoid fossa of the neck of the mandible and capsule and intra-articular disc of temporomandibular joint. Action, protrude, elevate the mandible and move the mandible from side to side. Medial pterygoid coming from the superficial head from the maxillary tuberosity and deep head from the lateral pterygoids. So both pterygoids, lateral and medial, they have two heads. Medial pterygoid, the superficial head from the maxillary tuberosity, the deep head from the lateral pterygoid plate. The two heads are fused together like lateral pterygoid and inserted to the rough medial surface of angle of the mandible. Action, protrude, elevate the mandible and move the mandible from side to side. Then we go to talk about trigeminal nerve. Trigeminal nerve is the fifth cranial nerve. As we know, there are 12 cranial nerves. Number 5 is trigeminal nerve. It has 3 branches: ophthalmic, mandibular, and maxillary nerve. We will talk today about the branch mandibular and maxillary nerve because it is related to the part of dentistry. This is the trigeminal nerve. Trigeminal nerve is the cranial nerve number 5. It is the largest cranial nerve. Emerge from the anterior surface of the bone. So this is the bone. This is the trigeminal nerve, which have 3 branches. These nerves are mixed, motor and sensory nerve. Trigeminal ganglion, this ganglion, this yellow, this blue one, ganglion. Trigeminal ganglion is sensory ganglion in the course of 5th cranial nerve. In the middle cranial fossa, to the side of the dural axis, called cavium trigeminale. It has concave and convex spect directed forward and give 3 nerves. So this is the trigeminal ganglion. This one is the trigeminal nerve. trigeminal nerve divided into three: ophthalmic division, maxillary division, and mandibular division. Ophthalmic nerve, maxillary nerve, and mandibular nerve. Ophthalmic and maxillary are pure sensory, while mandibular nerve is mixed motor and sensory. So trigeminal nerve has three branches: ophthalmic, maxillary, and mandibular. This is the maxillary nerve, and this is the mandibular nerve, coming to the upper jaw and maxilla, coming to the lower jaw, that is the mandibular, which is mixed motor and sensory. Mandibular nerve. This is the third division of trigeminal nerve. This is the third division of trigeminal nerve. It is mixed nerve, motor and sensory. It is a mixed nerve with large sensory and small motor root. This is the sensory root, and this one is the motor root. So it is smaller one in comparison with this sensory one. Motor root and sensory root, they are not equal in size. The sensory root is bigger than the motor root, and they are united to each other in the foramen ovalis. So this is the foramen ovalis. So this is one: ophthalmic nerve, pure sensory; maxillary nerve, pure sensory; while mandibular nerve are mixed sensory and motor, and they are mixed to each other in the foramen ovalis. So this is the foramen ovalis to reach the infratemporal fossa. So this is the foramen ovalis. After that, go to the infratemporal nerve, infratemporal fossa. So the main trunk descends through the foramen ovalis to reach the infratemporal fossa. Branches of the mandibular nerve. From the trunk, just from the trunk itself, there are one motor and one sensory. Nerve to medial pterygoid, that is motor. Meningeal branch, there are two sensory. From the anterior division, this nerve will be divided into anterior division and posterior division. Anterior division of the nerve give three motor and one sensory. Three motor branches of two temporalis, deep temporal nerve, masseter, and lateral pterygoid. So there are three motor nerve. There are two temporalis, masseter muscle, as well as lateral pterygoid, and one sensory, buccal nerve, to the skin and mucosa of the cheek. From the posterior division, we have three sensory and one motor. Three sensory and one motor. Auriculotemporal nerve, lingual nerve, and inferior alveolar nerve, all are sensory nerve. The nerve give to mylohyoid are motor nerve from the mylohyoid, and also anterior belly of digastric muscle. These are the branches of mandibular nerve. The second branch of the trigeminal nerve is maxillary nerve. Maxillary nerve. It is arise in the middle cranial fossa as the second branch of trigeminal ganglion. It passes forwards in the lower part of lateral of cavernous sinuses. Then it passes through foramen rotundum. So go through foramen rotundum to pterygopalatine fossa, where it gives rise to two sensory roots, so the sphenopalatine ganglion, and then infratemporal groove and infraorbital fissure, and terminate in the infraorbital nerve. What are the branches of maxillary nerve? We know that all are sensory. Meningeal branch, two roots of sphenopalatine ganglion, zygomatic nerve, which divided into zygomatico-temporal and zygomatico-facial, and posterior superior alveolar nerve. Branches of the infraorbital nerve. Infraorbital nerve, continuation of the maxillary nerve, known as infraorbital nerve, just below the orbit. Middle superior alveolar nerve, anterior superior alveolar nerve, and posterior superior alveolar nerve. And middle, anterior, and posterior. And terminal branch to the face, palpebral, and nerve to mucus of the maxillary nerve. These nerves are important for you as a dentistry physician. Middle, anterior, and superior alveolar nerve. Cavernous sinus. Usually when we are talking about the cranial nerves, we have to know this is the cavernous sinus. So cavernous sinus just below the hypophyseal gland, below the cilia turcica. And these are the nerves. The third nerve, fourth nerve, this is the ophthalmic and maxillary branch of the trigeminal nerve. And this is abducent nerve. And this is the inferior, and this is the internal carotid artery. So any infection in this area, it may lead to disturbance of the whole function of the brain, and it leads to a lot of complications. Maxillary nerve, this is the maxillary nerve. This is how it gives branches to the maxilla. This is also maxillary nerve. Then we have in this area maxillary artery. Maxillary artery. This is the maxillary artery. It is the largest terminal branch of external carotid artery. As you know, external carotid artery give around 10 branches. The largest one is the maxillary artery. It is taking origin within the substance of parotid gland behind the neck of the mandible. So the largest of two terminal branch of external carotid artery taking origin within the substance of parotid gland behind the neck of the mandible. So when you are working in the mandible, you have to know that maxillary nerve is close related to the neck of the mandible. The maxillary artery has three parts. First part, second part, and third part. So divided into three parts. First part, second part, and third part. First part run horizontally. This is the first part. Horizontally forwards within the parotid gland, between the neck of mandible and sphenomandibular ligament, along the lateral border of lateral pterygoid muscle. The first part run horizontally forward within the parotid gland, between the neck of the mandible and sphenomandibular ligament. Second part run laterally on the lateral surface of the lower head of lateral pterygoid muscle. So second part run on the lateral surface of head of lateral pterygoid muscle of mastication. Third part dips between the two heads of lateral pterygoid, reach the pterygopalatine fossa. This is the maxillary artery. Branches of maxillary artery, as we say already, first part, second part, and third part. Branches of the first part: middle meningeal artery, accessory meningeal artery, deep auricular and inferior alveolar, as well as anterior tympanic artery. For the second part, muscular branch and buccal branch. From the third part, infratemporal artery, greater palatine artery, sphenopalatine artery, posterior upper alveolar artery. Then we shift to salivary glands. Classification of salivary glands. Salivary glands, usually classify them to major salivary gland and minor salivary gland. Major salivary gland and minor salivary gland. Major salivary gland are parotid gland, submandibular gland, and sublingual gland. So these are the major salivary gland: parotid, submandibular, and sublingual glands. Minor salivary gland: labial, buccal, glossopalatine, palatine, and lingual. So there are many minor glands. Some people, they are saying around 1,000. So we have minor glands. That's why if you have a disease of major salivary gland, still there is other minor gland can secrete saliva. We are present in the labial, buccal, glossopalatine, palatine, and lingual glands. Salivary glands, major salivary gland. This one is parotid gland. Parotid gland. And this is it is duct. And this is the masseter muscle. And this is the buccinator muscle. This one is submandibular gland. This is duct coming up to the mouth, under the tongue. And this one is sublingual. So we have parotid, submandibular, and sublingual gland. Parotid, submandibular, and sublingual gland. This is the major salivary gland. Sublingual gland. Sublingual gland, lingual, this means tongue. So it lies between the floor of the mouth and the mylohyoid muscle. It is composed of large, main part, and small numerous glands. So sublingual gland under the tongue, between the floor of the mouth and mylohyoid muscle. It is composed of large, main part, and small numerous duct. It is duct known as Bartholin's duct, which open within the adjacent to the Wharton duct. It is mixed gland. Minor salivary gland, there are minor groups of salivary gland, may be found in the lips, cheek, tongue, floor of the mouth, palatine, larynx, trachea, and tonsils, as well as lacrimal gland. Let us go to the largest important major salivary gland. This is what? Parotid gland. Parotid gland is the largest salivary gland. Lies below the auricle, this means below the ear, which between the angle of the mandible and sternocleidomastoid muscle. Widget between the angle of the mandible and sternocleidomastoid muscle. Facial capsule of the gland. The gland has a capsule derived from the general and distinctive fascia of the neck. This fascia is split in two layers at the lower end of the gland. So the fascia, which is covering the gland, split in two layers at the lower end of the gland. Superficial layer, it covers the outer surface of the gland and masseter muscle, and attached above to the zygomatic arch. The deep layer of the fascia covers the inner surface of the gland and attached above to the base of the skull. The deep layer forms the stylomandibular ligament. This ligament separates the parotid gland from the submandibular gland. So what are the parts which separate the parotid gland from submandibular gland? It is the stylomandibular ligament, which is part of the deep fascia of the gland. This is the parotid gland, lateral surface covered by skin, fascia, and also there is a parotid lymph node. This is the lateral surface of the gland. So this is the gland, and this is the lateral surface where we have the skin and fascia as well as parotid lymph nodes. Anteromedial surface from outside towards we have related to masseter muscle. So we have the masseter muscle, ramus of the mandible, and medial pterygoid. So anteromedial from outside, masseter muscle, ramus of the mandible, and medial pterygoid. The posterior medial surface from outside and where it relates to mastoid process. So it comes out the posterior medial surface. This is the posterior medial surface. We have the mastoid process, sternocleidomastoid muscle, posterior belly of the gastric, styloid process, and its structures attached to it the wall of the pharynx. This is the parotid gland, and these are the surface, lateral surface, and we have anteromedial surface and posterior lateral surface of the parotid gland. So parotid gland, the superior surface, the upper end of the gland, is related to external auditory meatus. This one, external acoustic meatus or external auditory meatus, and this is the gland. Temporal branch of facial nerve, superficial temporal and auriculotemporal nerve. And parotid gland open into the vestibule of the mouth opposite the upper second molar tooth. This is the parotid duct open to the second upper molar tooth. Surface anatomy is corresponding to the middle third of the line. This is the middle third of the line, extending from the tragus of the ear to the point midway between the angle of the mouth and ala of the nose. Structure within the parotid gland. There are structures you have to know how they are arranged in parotid gland, especially when you are doing surgery for parotid gland. From deep to superficial. The lowest one, external carotid artery. So external carotid artery, then posterior facial vein, then facial nerve. So these are the structures within the parotid gland. Facial nerve, posterior facial vein, and external carotid artery. When you are working on the parotid gland, you find that the facial nerve give branches inside the material of parotid gland. So you have to keep your eye on this nerve, otherwise you will injure it and it lead to a lot of complications. This is the picture of parotid gland. So this is the parotid gland, and these are the nerves, veins, and arteries related to parotid gland. Facial artery. This artery is so important because it is related to the mandible. So facial artery take origin from the external carotid artery. In the carotid triangle above the lingual artery. Take the origin from the external carotid artery in the carotid triangle above the lingual artery. It descends deep to the posterior belly of the gastric and stylohyoid to reach the digastric triangle. Here it lies in the wall of pharynx. It ascends to make groove in the posterior end of the submandibular gland. Facial artery take origin from external carotid artery in the carotid triangle above the lingual artery. These are many branches of the external carotid artery. It is around 10, lingual artery and also facial artery. And this is the facial artery, how it ascends behind the gastric, posterior belly of the gastric toward the mandible. There are 4 branches coming from facial artery. Ascending branch, ascending artery, tonsillar artery, glandular artery, and submental artery. Then we go to submandibular region. Submandibular region, this means the region below the mandible. The first one is the digastric muscle. This is the digastric muscle. The gastric muscle, there are two pili, anterior pili and posterior pili of the gastric. So the gastric muscle has two parts. This is the anterior and posterior pili of the gastric. This is the posterior pili of the gastric. This is the mastoid process. This is the styloid process, and this is the mandible, and this is the hyoid bone. So this is the posterior pili of the gastric. This is the anterior pili of the gastric. The anterior pili of the gastric muscle arise from the gastric fossa of the mandible. So the anterior pili of the gastric arise from where? From the digastric fossa of the mandible. And the posterior pili arise from the mastoid notch. Mastoid notch. The posterior pili arise from mastoid notch, while the anterior pili arise from the digastric fossa of the mandible. Insertion, two pili meet in the intermediate line. This is two pili meet in the intermediate tendon, which is attached to the hyoid bone. So insertion to the hyoid bone, where the two parts are met to each other. Nerve supply, the anterior pili is supplied by myelohyoid nerve, branch of mandibular nerve. The posterior pili supplied by facial nerve. That's why sometimes we are asking as a multiple choice, which muscle have two nerve supply, two cranial nerve supply. This is digastric, because the posterior pili from trigeminal thoracomandibular nerve, the anterior pili from trigeminal thoracomandibular nerve, and the posterior pili coming from facial nerve. This is the digastric muscle, the part of the gastric muscle. This is how it is connected to the hyoid cartilage or hyoid bone. This is the deep structure of the structure. This is the anterior pili. This is the posterior pili. You concentrate, you have internal jugular. You have also carotid artery. This is the carotid sheath, where it contains artery, vein, and nerve. Above, it is divided into two, internal and external carotid artery. Submandibular gland. We have already said that the salivary gland and major salivary gland, which are submandibular, sublingual, and parotid. This is the submandibular salivary gland. The gland consists of two parts: large superficial and small deep part. Large superficial and small deep part. Position in the digastric triangle. Extend above it reach to the myelohyoid line of the mandible, and lower it reach to the intermediate tendon of the gastric. Anteriorly to the mental foramen. Anteriorly to the mental foramen, posterior to the angle of the mandible. So the angle consists of two parts: large superficial and small deep part. Position in the digastric triangle. Extend above to reach the myelohyoid line of the mandible, and below it reach the intermediate tendon of the gastric. Anteriorly to the mental foramen, posterior to the angle of the mandible. The superficial part of submandibular gland, it has three surfaces: infrolateral, lateral, and medial surface. Infrolateral, lateral, and medial surface. The deep part of the gland is semi-detached. It seems to be detached from the superficial part. Semi-detached from the gland. Arise from the medial surface between the myelohyoid and hypoglossus along the submandibular duct. The submandibular duct, it is 5 centimeters long, arise from the medial surface of gland, run forwards, upwards between the myelohyoid and hypoglossus muscle. The lingual nerve hooks around the duct. You have to know the relation between the lingual nerve and this duct. It hooks around the duct. The duct open into the floor of the mouth to the summit of the sublingual papillae. These are important one to know the relation between the duct and lingual nerve. The gland supplied by facial artery, and it is innervated by lingual nerve. Submandibular gland and sympathetic plexus from the plexus around the facial artery. This is a picture of submandibular gland. This is the submandibular gland. This is the facial artery. This is the submandibular gland, and this is the duct. Relation of submandibular gland, as we say, it has medial relation, anterolateral surface, and medial surface. Muscle is related to the tongue. We have genioglossus, genohyoid, genoglossus, styloglossus, and hyoglossus. Genohyoid are origin, insertion, and action. Genohyoid originated from the inferior genial tuberosity. Inferior genial tuberosity. Insertion to the anterior surface of the body of the hyoid bone. Genohyoid muscle, genoglossus muscle, styloglossus muscle, and hyoglossus muscle. Action of genohyoid to pull the hyoid upwards and for more words in deglutations or swallowing. Genoglossus from the superior genial tuberosity arise from the superior genial tuberosity and inserted fibers from the fan-shaped. It's from the fan-shaped to form the main pike of the tongue. So it is inserted to the tongue. Genoglossus, it is fibers form the fan manner to form the main bulk of the tongue. So the main bulk of the tongue formed from genoglossus. So it is inserted to the tongue. It is to protrude the tongue. So action of genoglossus, protrude the tongue. Styloglossus, from the front of lateral surface of the styloid process at the tip and from the upper end of stylomandibular ligament. Inserted to the side of tongue and innervated by hypoglossal nerve. It is draw the tongue upwards and backwards. Hyoglossus, from the body of greater horn of hyoid, inserted to the tongue, to the side and posterior half of the tongue, and innervated by hypoglossal nerve. Drive the hyoid bone and depress the posterior half of the tongue. This is the muscle of the genoglossus, genohyoid, styloglossus, and hyoglossus. Hypoglossus muscle. This is the hypoglossus muscle. This muscle from the body of greater horn of the hyoid pass upward to the external side of the posterior half of the tongue, innervated by hypoglossal nerve. So this nerve is hypoglossal muscle. Hypoglossal muscle. So hypoglossal muscle from the body of greater horn and inserted to pass upward, inserted to the side of posterior half of the tongue. So this is the hypoglossal muscle. Hypoglossus, it is passed upward to be inserted to the side of posterior half of the tongue. Hypoglossal nerve arise the hyoid bone and depress the half of the tongue. Hypoglossus muscle structure in the lateral surface of the hypoglossus muscle. This is the structure in the surface of the hypoglossal. Myelohyoid muscle. Myelohyoid muscle from the myelohyoid line. Myelohyoid muscle from the myelohyoid line. So this is the myelohyoid muscle. This is myelohyoid muscle from the myelohyoid line. Myelohyoid line. The greater part of both muscles meet in the medial raphe called myelohyoid raphe. So they are meet each other here. Myelohyoid raphe. Called myelohyoid raphe, which extend from the symphysis menti to the hyoid bone. So this is the myelohyoid muscle coming from the myelohyoid line and inserted in the midline. Here it is known as myelohyoid raphe, which extend from the symphysis menti to the hyoid bone. The two muscles therefore form the floor of mouth known as diaphragmatic oris. So this is the floor of the mouth. This is known as diaphragmatic oris. The posterior part of the muscle is inserted to the hyoid bone. So there are greater part of the muscle mid to midline in the diaphragmatic oris. The posterior part of the muscle inserted to the hyoid bone. Nerve supply, myelohyoid nerve, action, elevation of the hyoid bone, floor of the mouth and tongue during deglutitions. Scalene group of muscles. There are three muscles, three scalene groups, three scalene muscles. Scalenus anterior, scalene medius, and scalenus posterior. So I have anterior, medius, and posterior. Scalenus anterior originated by 4 steps from the anterior tubercle of transverse process of C3, C4, C5, and C6. By slips from the anterior tubercle of transverse process of C3, C4, C5, and C6. Inserted into the scalene tubercle on the inner border of the scalene ridge, on the upper border of the first strip. Nerve supply from the anterior rami of C4, C5, and C6. Action, flexion of the neck to forwards and lateral elevation of the first rib. Scalenus medius, origin from the posterior tubercle of all cervical transverse process. So scalenus means all cervical, while this one C3, C4, C5, C6. Insertion to the posterior part of the upper surface of the first rib. Scalenus posterior, origin from the transverse process of the lower 3 cervical vertebrae. Insertion to the second rib, nerve supply from the lower 5 or 6 cervical vertebra. 5 or 6 cervical vertebra. Prevertebral muscle. Prevertebral muscle. There are many muscles as a prevertebral muscle. These are prevertebral muscle are rectus lateralis, rectus anterior, longus colli, and longus capitis. These muscles, between these scalene muscle, there are coming arteries. So sometimes these muscles are give rise to scalene syndrome, where we have to cut the scalenus medius to have space between them.